Okay, I think we will get started. As more people join, we'll just get things underway here. We've got a lot of great content to share with you today on our webinar in our series Back to Basics. This webinar covers really important information for you all on developing state plans on aging under the Older Americans Act and also the Corrective Action Plan process. So we've got a lot to cover today, so we're going to jump right in. We'll go to our next slide and cover some housekeeping items as more people are joining us. This webinar is being recorded, and the slides as well as recordings will be posted on acl.gov/OAA rule, as well as on ACL's current AOA program instructions webpage in the coming weeks. The chat feature is disabled for this webinar. However, you can use the Q&A feature to leave questions. We're going to do our best, as we have in previous webinars, to respond to your questions live, or we'll take them back for further consideration. Additionally, CART and ASL services are available. You can go along to the bottom of your Zoom screen, click on More, and then select Captions for CART and select Interpretation for ASL. Let's go to the next slide. And I want to more formally welcome you. My name is Kari Benson. I am the Deputy Assistant Secretary for Aging at the Administration for Community Living. Would like to extend a warm welcome to all of you and thank you for taking the time to attend our webinar on the updated State Plan on Aging guidance and the Corrective Action Plan process. Today's webinar is sure to be a good one. We have put a lot of information into this webinar, and we're going to get through it all with you so that we can provide to you the overview on State Plan on Aging guidance and coming into compliance with the Older Americans Act final rule. I just wanted to note a few reasons why this webinar today is particularly important. The topics, both the state plans on aging and the corrective action plan process, are very important to the work that we all do under the Older Americans Act. In particular, I would note that the state plans on aging are essentially the state's application and justification for receiving federal funds through the Older Americans Act. The state plan development process also serves as a key tool for the state to lay out a vision for the state plan period, as well as provide a critical opportunity for public input, especially from older adults and caregivers themselves, who ultimately are impacted by the plan. The state agency is required to submit a state plan that is informed by the area plans and to have public participation. And the state and area plans can be used in promoting your local and state advocacy messages. And as you will hear later in the webinar, the Corrective Action Plan is an important tool that we are going to be using to track and support your efforts at the state level to come into compliance with the Older Americans Act final rule. I want to encourage all of you at the state units on aging to take the time to do it right when you are addressing gaps you've identified in your compliance. Be sure to work collaboratively with your area agencies on aging and take the time necessary to put into place the policies and procedures that will support a strong and vibrant network. And we are committed to working with you along the way. So let's go to the next slide and we'll take a look at the agenda we're going to be using for today. We'll start by briefly discussing the information collection as it relates to the state plan guidance and corrective action plan documents. Then we'll review the 2024 updates to the state plan on aging guidance and the corrective action plan, or CAP, process. And then we'll end with a summary and review of available as well as planned resources. So if we go to the next slide, we'll move into discussing the information collection, or IC, regarding ACL's Administration on Aging formula grant programs published in the Federal Register, as it holds particular relevance to today's discussion on state plan guidance and corrective action plans. The activities discussed briefly here are in accordance with the Paperwork Reduction Act of 1995, or PRA. On the next slide, we will go into this in some more detail. In October of 2023, ACL published in the Federal Register a 60-day notice soliciting comments on the information collection requirements relating to our Administration on Aging formula grant programs for Older Americans Act Titles 3 and 7. On September 26 of 2024, a 30-day notice was published to collect comments on the information collection requirements, with comments going directly to OMB. The public comment period closed yesterday, October 28th. The IC included the following documents, also referred to as instruments in federal lingo. It included the new state plan guidance, or SPG, for 2024, which we'll review today. It included the corrective action plan, or CAP, template and instructions, which we'll also review today, and financial forms and instructions related to Older Americans Act program management. We received a number of inquiries regarding initial inability to view the instruments on reginfo.gov. As a result, ACL's regional administrators, or RAs, have sent emails within the last few weeks to State Unit on Aging contacts with those instruments. So please ask your RA if you have any additional questions related to this IC or its instruments. Please note that these instruments are still considered draft until ACL receives final OMB approval. And now I'm happy to turn things over to Nicole for the next part of the presentation. Nicole?
Thank you, Kari. Hello, everyone. I'm Nicole Becerra, and I'm an Aging Services Program Specialist here at ACL. For a visual description, I'm a dark-haired woman with glasses, wearing a cream sweater and blazer, and a blue background with the ACL logo on it. Today, I will begin the overview of the new State Plan on Aging Guidance Update. Next slide, please. Congress originally passed the OAA in 1965 in response to concerns by policymakers about a lack of community social services for older adults. The original legislation established authority for grants to states for community planning and social services, research and development projects, and personnel training in the aging field. Additionally, Section 307 of the OAA, as amended in 2020, authorizes the Assistant Secretary for Aging, or ASA, to prescribe criteria for the State Plan on Aging development and content. The OAA provides the foundation for the National Aging Network, which includes the Administration on Aging, or AOA, State Units on Aging, SUAs, Area Agencies on Aging, AAAs, tribal organizations, service providers, and volunteers. Next slide, please. This state plan guidance is for any new state plan on aging taking effect on or after October 1, 2025. This guidance is consistent with the Older Americans Act, as amended in 2020, and reflects changes to the OAA program regulations, which had an effective date of March 15th, 2024, and a compliance date of October 1, 2025. Code of Federal Regulations, 45 CFR Part 1321. Next slide, please. SUAs are an integral part of the Aging Network and are the designated agencies responsible for developing and administering a multi-year state plan that provides goals and objectives related to assisting older residents, their families, and caregivers. The SUA develops and administers the state plan by working in close coordination with area agencies, tribes, and tribal organizations, and other parts of the Aging Network. Additionally, as addressed in Section 307 of the OAA as amended and Section 1321.27 of the updated OAA regulations, says that the state plan documents the tangible outcomes expected for state long-term care reform efforts, translates activities, data, and outcomes into proven best practices, which can be used to leverage additional funding, provides a blueprint for coordination and advocacy activities that state the state will undertake to meet the needs of older adults, including integrating health and social service delivery systems, and builds capacity for long-term care efforts in the state. Next slide, please. States, through the SUA, may elect to develop a new state plan for a 2, 3, or 4-year period. SUAs must use this updated guidance when creating new state plans. Proposed state plans must be available for a minimum of 30 calendar days for public review and comment, providing reasonable notice to the public and stakeholders, inviting them to submit comments on a publicly available draft of the plan. Many SUAs do this through holding public hearings and/or posting an invitation to comment online. ACL suggests this occur by April 1 of the calendar year in which the new state plan is due. To help ensure a successful submission, each state shall submit at least one complete draft of the new state plan to the appropriate ACL regional office by June 1 of the calendar year in which the new state plan is due. The SUA shall work with the ACL regional office in reviewing the new state plan for compliance with requirements. Looks like we lost our PowerPoint, but give us one moment and we will get that back up. All right. I see it on my end, so I'm going to go ahead and continue on. Each new state plan signed by the governor or the governor's designee is due to the appropriate ACL regional administrator by July 1 of the calendar year in which the new state plan begins. The signed state plan will be reviewed and then forwarded to the ASA when recommended for approval. All state plans require the written approval of the ASA. This slide demonstrates the minimum requirements in terms of timeframes and that states need and should take into account their own internal review and approval processes, including time needed to obtain the governor's signature and determining when to first submit a draft to the regional office for review, so that they will be able to meet the July 1 submission date for a signed plan. A state should not be considered final and approved by ACL until the state receives a letter from ACL signed by the ASA approving the plan. States that fail to meet these timeframes will be in violation of 45 CFR 1321.33 and risk the new state plan not being approved by the ASA prior to the expiration of the current state plan. Next slide, please. This slide outlines the next 4-year state plan timeframes for reference. Next slide, please. The next several slides will outline the states with plans due per their year. So this slide lists states with plans due in 2025. Next slide, please. And this one outlines the plans due in 2026. We'll pause for a moment for folks to take a look. Next slide, please. This slide outlines plans due in 2027. Next slide, please. And finally, this slide outlines the plans due in 2028. Next slide, please. State plan content. The state plan content includes the following: verification of intent, the narrative, which includes the executive summary, context, stewardship, and oversight, goals, objectives, strategies, and outcomes. Key topic areas that cover OAA core programs, greatest economic need and greatest social need, expanding access to home and community-based services, caregiving, and attachments. In the next several slides, we will break down each component in more detail. Next slide, please. Verification of intent. The state plan must be signed by the governor or the individual designee to whom the governor has granted signatory authority, such as the SUA director. For the narrative portion of the state plan should be no more than 30 pages. To stay within this maximum, the SUA may wish to submit a lengthy survey information, demographics, organizational charts, maps, and additional items as separate attachments. The narrative should clearly address the following areas. The executive summary. The executive summary stands alone in summarizing the state plan's efforts on behalf of older individuals over the state plan cycle. The context sets the stage for the state plan and describes the issues addressed in the remainder of the document. This includes a summary of needs assessment findings, how the plan is informed by and based on area plans, how the SUA solicited and others' input on development of the plan, and how the state defines greatest economic need and greatest social need. Stewardship and oversight. This section of the narrative is new and comes at a time where there is an increased interest in stewardship of public funds and oversight of Older Americans Act programs. In addition, the 2024 OAA final rule to update the OAA program regulations includes requirements and clarifications related to stewardship and oversight activities. Our first webinar in the Back to Basics series also discussed stewardship, oversight, and advocacy responsibilities. Please refer to acl.gov/OAA rule, RULE, to view the webinar materials. Stewardship and oversight of OAA programs support the Aging Network to meet the mission and vision of the OAA through a holistic program management. Such program management includes having appropriate program, fiscal data, evaluation, training, and communication policies and procedures that are in alignment with one another, maintaining the integrity of the advocacy activities, and assessing and adjusting to supporting ongoing program implementation of targeted, effective, efficient activities. An ideal way to explain the SUA's stewardship and oversight of plans and activities is to include information about the level and frequency of services provided, the number and percentages of different demographic groups of people and organizations receiving services, along with the percentage of overall population and the percentage of people with the greatest economic and greatest social need formed by each demographic group, and documentation of program quality. For example, solicitation of participant feedback. The SUA should describe in detail of the stewardship and oversight activities it will undertake during the state plan cycle and how the SUA develops, issues, and implements its policies and procedures. I will now turn it over to my colleague, Chris Mitchell.
Thank you, Nicole. Hi, I'm Chris Mitchell, Aging Services Program Specialist within the Administration on Aging. I'm a Black male and I'm wearing a white shirt and a blue sport coat. I will cover additional portions of the state plan guidance, starting with the goals, objectives, strategies, and outcomes portion of the narrative section. Each state plan will have a number of performance measures. ACL requires the performance measures to be broken down into goals, objectives, strategies, and outcomes. Goals are visionary statements that describe the strategic direction in which the state or territory is moving. Objectives are the specific, measurable, attainable, relevant, and timely steps the state or territory will take to achieve its goals. Strategies outline how the state will achieve the goals and objectives. Outcomes document the measurable benefit older individuals should derive from the state plan goals, objectives, and strategies. To the extent possible, outcome measures should include short, intermediate, and long-term outcomes. Short-term outcomes typically include improvements in knowledge, awareness, or perceptions. Intermediate outcomes typically include changes in behaviors, policies, or processes. Long-term outcomes should reflect the goals of the Older Americans Act and/or specific programs. If SUAs are collecting data for measures that align with the goals, objectives, strategies, and outcomes that are also inclusive in the key topic areas, they do not need to collect new data. Rather, SUAs should report on the data they are already collecting. Several years ago, ACL provided a training on measuring progress toward achieving your state plan goals and objectives. It featured a discussion on outputs versus outcomes, categories of outcomes, and how they can be measured, and more. This content remains relevant, and the link to the slides, recording, and transcript from the training are listed on this slide and are posted on the current ACL AOA program instructions webpage. In summary, this part of your state plan is directly linked to state plan key topic areas, which we will discuss next. There are 4 state plan key topic areas which we will further explore in the following slides. State plans must clearly incorporate all areas to address in each state plan key topic area, and they include priorities set forth by Congress in the Older Americans Act as amended. In developing objectives, consider the role these topic areas serve in optimizing the state's long-term services and support systems for older adults and their caregivers. States and territories must include performance measures in their state plans to describe their progress towards the areas to address. That is the direct link between key topic areas and performance measures that I mentioned earlier. The 4 state plan key topic areas are Older Americans Act core programs, greatest economic need and greatest social need, expanding access to home and community-based services, and caregiving. The Older Americans Act core programs is the first key topic area that I will discuss. This topic area includes the basic core requirements of the Older Americans Act that every SUA should be addressing under the Act. All core programs by subtitle of Title III and Title VII must be addressed in the state plan, including Title III Parts B, C, D, and E, as well as Title VII Chapters 2 Ombudsman, 3 A&E, and 4 Legal Assistance Developer. Areas to address within this core program topic area include, for Title III, age and dementia-friendly efforts and access to assistive technology, recognizing and addressing malnutrition, coordination activities like coordinating Title III programs with Title VI Native American programs. Please note that even if your state does not have Title VI grantees, the state plan has to address activities to increase access and coordination for Native American older adults, including those living outside of reservations and other tribal lands. Visit acl.gov/OAA rule to view our Back to Basics webinar recording, slide deck, and fact sheet on Title III and Title VI coordination for more information. Additionally, state plans must also address improving coordination between the Title V Senior Community Service Employment Program, administered by the Department of Labor, and the other Older Americans Act programs. Please see the 2 CSEP related links that were just dropped into the chat for additional information. Title VII areas to address include preventing, detecting, assessing, intervening, and/or investigating elder abuse, neglect, and financial exploitation, or A&E, and supporting and enhancing multidisciplinary responses to A&E to involve partners like Adult Protective Services, Long-Term Care Ombudsman, and others. Other general areas to address include strengthening and/or expanding Title III and Title VII services. Here's an example for Title III. Adopt a statewide case manager certification program and ensure that all case managers funded with state and federal funds are certified. Here's an example of strengthening Title VII services. Increase volunteers in the Long-Term Care Ombudsman program. State plans must also address integrating core programs with ACL's discretionary grant programs. Knowing the applicable ACL discretionary grants in your state should be part of your needs assessment and context setting activities. To search for ACL grants available, go to grants.gov. Older Americans Act core programs was a key topic area in the previous guidance. All of the areas to address are the same, except that ACL removed screening for fall-related traumatic brain injury as a requirement, although SUAs may still develop performance measures for this topic. One other change is that the topic area also now includes dissemination of information about the state assistive technology entity and access to assistive technology options for serving older individuals, which in the previous guidance was addressed in the COVID-19 topic area, which is not a separate key topic area in the new state plan guidance. Next slide, please. The next key topic area that I will discuss is the greatest economic need and greatest social need key topic area. Much of what is included on the slide is in the prior state plan guidance. Focusing Older Americans Act services on individuals who have the greatest economic need and on those who have the greatest social need are basic tenets of the Act. These are longstanding principles of the Older Americans Act. The Older Americans Act final rule provides guidance regarding the targeting of services to these populations, and states to demonstrate their commitment to these tenets by addressing the areas covered in this key topic area. As I mentioned, the SUA will include their definition of greatest economic need and greatest social need in the context section of the plan. In this key topic area section, SUAs will further describe their plans, measures, and objectives to demonstrate progress toward the areas to address specified in the guidance. To include determining effectiveness of services and needs for identified populations, conducting outreach to identified populations and targeting services to those who meet the SUA's definitions of greatest economic need and greatest social need. As a note, specifying targeting of services to those who meet the SUA's definitions of greatest economic need and greatest social need is new. Impacting social determinants of health for older individuals, adjusting meals for cultural considerations and preferences, providing medically tailored meals as feasible, and offering home-delivered meal participants the option to participate in and to attend congregate meal sites and other activities. And that's based on a person-centered approach and local service availability. As a note, specifying offering home-delivered meal participants the option to participate in congregate meals and other activities is new. Serving older adults living with HIV and AIDS, and supporting participant-directed, person-centered planning for older adults and their caregivers across the spectrum of long-term services and supports. This key topic area includes two items that were previously addressed in the COVID-19 topic area, which is not a separate key topic area in the new guidance. These include incorporating innovative practices that increase access to services mainly for those with mobility and transportation issues, as well as those in rural areas, and educating about the prevention of, detection of, and response to negative health effects associated with social isolation. Next slide, please. The next key topic area that I would like to discuss is expanding access to HCBS. Ensuring access to HCBS is intrinsic to nearly all of the programs funded through the Older Americans Act. The Aging Network has an important role to play in efforts to improve the quality of HCBS and expand the availability of HCBS. In their state plans, states are asked to describe how they are building HCBS capacity and improving program quality through innovation, partnerships with other states and local agencies, community-based organizations, both within and outside the Aging Network, and other efforts that focus on ensuring older adults can live what they choose, with the people they choose, and with the ability to participate fully in their communities. ACL did not add any new areas to address in this topic area. Next slide, please. The last key topic area is caregiving. Support for caregivers is essential. Families are the primary source of support for older adults and people with disabilities in the U.S. Many caregivers work and provide care, experiencing conflicts between these competing responsibilities. Many caregivers are at risk to a decline in their own health. ACL is asking SUAs to address their planned efforts in this important area. ACL made minimal changes to this key topic area as compared to previous state plan guidance. In the previous guidance, ACL asked SUAs to document best practices related to caregiver support. A lot of that work is spearheaded by the TA Resource Center and the National Caregiver Support Collaborative grantees. Therefore, it is no longer a requirement. ACL added implementing the actions in the national strategy to support family caregiving that can advance your state's ability to better recognize and support family caregivers, and removed implementing recommendations from the Raised Family Caregiver Advisory Council. Next slide, please. Between Nicole's presentation and mine, that covers all parts of the narrative section of the state plan. Next, I will discuss state plan attachments. I will cover attachment A and B in this slide, and attachment C, D, and E in upcoming slides. Attachment A is for state plan assurances and required activities. It includes statutory assurances and activities related to the development and implementation of state plans. It must be reviewed, signed by the SUA director, and included as a part of the state plan. In addition, documentation of how the SUA will address each assurance must be maintained at the SUA and made available for review by ACL as requested and appropriate. For example, there is an assurance that mechanisms must be in place to identify and remove conflicts of interest prohibited by the Act. ACL could ask the SUA to provide its policies and procedures that address that assurance. Also keep in mind that these are among the items ACL may review with SUAs during their site visits. The importance of this document is significant. By signing attachment A, the authorized official commits the SUA to performing all listed assurances and activities as stipulated in the Older Americans Act as amended in 2020. Attachment B, information requirements, is a list of items to which states must provide a detailed response. The items are derived from specific parts of the Act and regulations. For example, states that wish to provide shelf-stable, pick-up, carry-out, drive-through, or similar meals using Title III Congregate Nutrition, C1, service funding must provide a response on how they will meet the specified conditions. If states have a policy on the topic, they can provide a response and include the policy as a supplemental document to the state plan. We will continue discussing attachment B on the next slide. This slide lists the topic areas in attachment B, information requirements. Those that are bolded contain new requirements as a result of the 2024 Older Americans Act final rule. Any SUA who needs to amend their state plan to come into compliance with the final rule by October 1st, 2025, will need to address these required topic areas. Number 1 on the slide, greatest economic need and greatest social need. Older Americans Act Final Rule, Section 1321-27D requires that each state plan must include a description of how greatest economic need and greatest social need are determined and addressed. Visit acl.gov/Older Americans Act Rule for our Back to Basics webinar materials on state and area plans, as well as funding formulas to view definitions for greatest economic need and greatest social need, and our Back to Basics webinar materials on nutrition services under Title III to view steps for serving populations of greatest economic need and greatest social need. Number 2 on the slide, Native Americans, greatest economic need and greatest social need. Older Americans Act Final Rule, Section 1321-27G requires demonstration that the determination of greatest economic need and greatest social need specific to Native American persons is identified, that the services provided under Title III will be coordinated with services provided under Title VI, and that the SUA shall require AAAs to provide outreach where applicable. Number 3 on the slide, activities to increase access and coordination for Native American older adults. Older Americans Act Final Rule, Section 1321-53 requires, for states where there are Title VI programs, SUA policies and procedures to be developed in coordination with the relevant Title VI program director, and to explain how the state's aging network will coordinate with Title VI programs. Number 10 on the slide, shelf-stable, pick-up, carry-out, drive-through, or similar meals using Title III Congregate Nutrition, C1, service funding. Older Americans Act Final Rule, Section 1321-87A12 allows SUAs the option to use Title III C1 funds for shelf-stable, pick-up, carry-out, drive-through, or similar meals, subject to certain terms and conditions. Section 1321-27J includes requirements for the state plan if the state elects to pursue this activity. Please note, this is only for C1 funds. This use of Title III C2 funding is permitted under 45 CFR 1321-87A2 without need to specify it in the state plan. Visit acl.gov/Older Americans Act rule for our Back to Basics webinar materials on nutrition services under Title III for more information on this option. Number 11 on the slide, funding allocation related to the Ombudsman Program. Older Americans Act Final Rule, Part 1324, Subpart A, requires information on how the SUA will coordinate with the State Long-Term Care Ombudsman and allocate and use funds for the Ombudsman Program. Number 12 on the slide, funding allocation related to Elder A&E. Older Americans Act Final Rule, Part 1321-27K, requires information on how the SUA will allocate and use funds for prevention of elder abuse, neglect, and exploitation. Number 13 on the slide, monitoring of assurances. Older Americans Act Final Rule, Section 1321-27M, requires the SUA to describe how they will conduct monitoring of their assurances to which their tests are being met. Number 14 on the slide, state plans informed by and based on area plans. Older Americans Act Final Rule, Section 1321-27C, requires evidence that the state plan is informed by and based on area plans, except for single PSA states. Number 15 on the slide, public input and review. Older Americans Act Final Rule, Section 1321-29, requires the SUA describe how they consider the views of older individuals, family caregivers, service providers, and the public in developing and administering the state plan. Number 16 on the slide, program development and coordination activities. Older Americans Act Final Rule, Section 1321-27H, requires certification that any program development and coordination activities will meet the laid out requirements. Note, this requirement is only applicable for states that elect to pursue these activities. And lastly, number 17 on the slide, legal assistance developer. Older Americans Act Final Rule, Section 1321-27L, requires information on how the SUA will meet responsibilities for the legal assistance developer. Next slide, please. Next, I will discuss Attachment C, interstate funding formula requirements and funds distribution plans. Interstate funding formulas, or IFF, apply to states with AAAs, and fund distribution plans apply to single PSA states. There are changes to IFF and fund distribution plan requirements in the new state plan guidance. As it relates to IFFs, in the new state plan guidance, the IFF descriptive statement must apply the SUA's definition of greatest economic need and greatest social need. However, an IFF factor for each population included in the definition is not required. For example, an SUA may specify that it will use one factor based on the low income and rural population of individuals aged 60 and older in its IFF to meet populations identified as in greatest economic need and greatest social need. Another SUA may use two separate factors, one for low income individuals aged 60 and older, and another for rural individuals aged 60 and older. Another example, again not required nor exclusive, for how to serve those in greatest economic need and greatest social need includes a base amount of funding to PSAs to ensure services to people living in rural areas. SUAs must include a statement in their IFF that discloses if, prior to distribution under the IFF to the AAAs, funds are deducted from Title III funds for state plan administration, area plan administration, disaster set-aside funds, and/or long-term care ombudsman allocations. The disaster set-aside disclosure is new. In the new state plan guidance, definitions of the terms used in the IFF's mathematical formula are now required. As it relates to single PSA states and fund distribution plans, ACL now requires including a justification in the fund's distribution plan if the single PSA determines it meets requirements to provide services directly. ACL covered the IFF in the Back to Basics webinar on state plan and area plans and funding formulas. We included a resources slide at the end of this presentation for easy access to that information. Please note that ACL will thoroughly review all IFFs and funds distribution plans. If any required information is not included, or any corrections or changes are needed to the current IFF or funds distribution plan, please consult with your regional office on how to proceed. Failure to follow the required process for such additions, changes, or corrections may result in a delay in the state plan approval. Next slide, please. Attachment D and E are new attachments to the state plan. Attachment D must show the geographic boundaries of each PSA and identify the AAA that serves each PSA. Attachment D does not apply to single PSA states. In Attachment E, the state plan must include information that demonstrates the SUA's compliance with the minimum time period, at least 30 calendar days, absent a waiver from ACL, for public review and comment of the new state plan. Note, other attachments to the plan could include data sources, need analysis, reports, and special initiatives that the SUA wants to highlight. A few takeaways from the state regarding the state plan attachments. ACL requires state plans to include 5 attachments, attachments A, B, C, D, and E. Attachment A, assurances that the state plans must attest to and the SUA director must sign. Attachment B are provided in the form of items to which the SUA must provide a direct response. Attachment C is the SUA's IFF or funds distribution plan. Attachment D is new, and it's the place where the SUA identifies the geographic boundaries of the AAAs and PSAs. This does not apply to single PSA states. And Attachment E is also new and is used to provide evidence of the minimum public comment period for the state plan. Next slide, please. Before I conclude my part of the presentation, I would like to briefly address one additional topic of reallocation of funds within states. ACL has seen an uptick in TA requests on this topic, so we decided to cover it with this audience. As specified in the final rule at Section 1321.49, SUAs may reallocate funding within the state when a AAA voluntarily or otherwise returns funds, subject to the state agency's policies and procedures, which must include the following. If a AAA voluntarily returns funds, the AAA must provide evidence that its governing board or chief elected official approves the return of funds. Funds must be made available to all AAAs that request funds available for reallocation. The IFF shall be proportionally adjusted based on AAAs that request redistributed allocations, and Title III funds subject to reallocation may only be reallocated to AAAs via the proportionally adjusted IFF. I will now hand the presentation over to my colleague, Rhonda. Thank you.
Thanks so much, Chris. I am Rhonda Schwartz. I am a regional administrator here at ACL. I am a white woman with shoulder-length curly hair. I am wearing a black sweater today with a multicolored scarf, and I am sitting in my office. The next topic that we will cover today is state plan amendments. For state units on aging that do not have a state plan due to take effect on October 1st of 2025, and if your current state plan does not comply with the OAA final rule requirements, it will be necessary to amend your state plan by October 1st of 2025 in order to comply with the OAA final rule. This slide includes the additional information that will be required to be included in state plans by October 1st of 2025 under the OAA final rule. This list includes requirements discussed previously with regard to Attachment B, as well as those that are separate and are underlined in the slide and that relate to attachments C, D, and E. I'm not going to read through the entire list since it's again a repeat of what Chris discussed above, but I'll just pause for a second so you can take a look there at that slide. Okay, we can go on to the next slide. Now, Section 1321.31 of the OAA final rule clarifies which amendments require prior approval by the Assistant Secretary for Aging and which only need to be submitted for purposes of notification. This chart shows examples of when state plan amendments must be approved by ACL and also shows amendments that do not require ACL approval. So I'm going to just go through this chart. Amendments that would require prior approval by the Assistant Secretary for Aging include new amendments needed because of new or revised statutes or regulations as determined by the Assistant Secretary for Aging, an addition, deletion, or change to a state's goal, assurance, or information requirement statement, a change in the state's IFF or funds distribution plan, a request to waive state plan requirements, or other changes as required by guidance as set forth by the Assistant Secretary for Aging. Now, here are examples of amendments that would not require prior approval by the Assistant Secretary for Aging. A significant change in a state law, organization, policy, or state unit on aging operation, a change in the name or organizational placement of the state unit on aging, distribution of state plan administration funds for demonstration projects, a change in a PSA designation or a AAA designation, or if a state unit on aging is exercising major disaster declaration flexibilities as set forth in section 1321.101. Next slide. Now, the SUA must submit a draft of a state plan amendment that requires ACL approval to its assigned ACL regional office at least 120 calendar days prior to the proposed effective date of the amendment. And the SUA must cooperate with the regional office in the review of the plan amendment for compliance with applicable requirements. The plan amendment must be submitted to the appropriate regional office for approval by the Assistant Secretary of Aging at least 90 calendar days before the proposed effective date of the state plan amendment. In additionally, please note state plan amendments that require ACL approval must be made available for public comment for a minimum of 30 calendar days. Now, for compliance by federal fiscal year 2026, a draft version would need to be submitted by the appropriate ACL regional office by June 1st of 2025. The final version, signed by the governor or their designee, must be submitted for approval to the appropriate ACL regional office by July 1st of 25. And once approved, the effective date would be October 1st of 25. When you're thinking about these dates and doing your planning, please keep that 30-day public comment period in mind. Also, you don't have to wait until these dates to submit your state plan amendment. You can submit your amendment earlier. For state plan amendments that do not require ASA approval, within 30 days of the action, the State Unit on Aging must submit the amendment to the appropriate ACL regional office. This does not mean 30 days in advance. It means within 30 days. It can be within 30 days after the action. The ACL regional office will review the amendment to confirm the content, that the contents do not require approval of the Assistant Secretary for Aging, and will acknowledge receipt of the state plan amendment by notifying the head of the State Unit on Aging in writing. Please refer to the Back to Basics webinar materials on state and area plans, as well as funding formulas posted on acl.gov/OAA rule for more information on state plan amendments. We anticipate that all states without a new state plan due in 2025 will be doing a state plan amendment and/or a corrective action plan in 2025. If you are unsure if your state plan amendment will require public input and prior approval, please reach out to your regional administrator. Next slide. Okay, now we're going to move on to the corrective action plan process. Okay, so as we all know by now, the effective date of the final rule was 30 days after it was published in the Federal Register, which was March 15th of this year. However, ACL, as we have relayed previously, is providing an extended implementation timeframe until October 1st of 2025. And we are providing robust technical assistance in coordination with ACL-funded resource centers and other partners to implement the final rule. There also will be a collaborative corrective action plan process for states that experience challenges in meeting this timeframe for certain provisions under the final rule. The State Unit on Aging and ACL will jointly identify progress milestones and a feasible timeline for addressing the areas at issue. And we envision that we will include all items with each SUA in a single corrective action plan for ease of communication and tracking. Each item will have its own unique milestones and overall time frame. Next slide. Don't mind me, I need a glass of water. Okay. Now we have developed a template for state units on aging to use for corrective action plans. Use of this template will be required. I will go through the template and some examples in a minute, but first I want to go through the instructions ACL has developed that accompany the template. As we indicated earlier in this webinar, both the CAP template and the instructions await final OMB approval, but we anticipate that any changes from the current drafts would be minor. These forms will be posted on our website at acl.gov/OAA rule, as well as ACL's current program instructions webpage after we receive OMB approval. So again, the instructions and the template will be in writing and available to everyone once we get the approval. So I'm going to go through everything now, but you don't have to write all this down because it's all going to be in the instructions. So first, let me tell you what's in the instructions. First, the corrective action plan or CAP process is intended to be collaborative. The State Unit on Aging and ACL will jointly identify progress milestones and a feasible timeline for the State Unit on Aging to come into compliance with the applicable requirements. ACL expects that state units on aging will make a good faith effort at achieving full compliance. And again, ACL's template must be used. The SUA will complete the CAP template and will submit it via email to their regional administrator for ACL's consideration and approval. The CAP template submission must be accompanied by a cover letter on the State Unit on Aging's letterhead and signed by the highest ranking management official, for example, the Chief Executive Officer of the agency or the Executive Director, again, of the State Unit on Aging, the highest ranking official of the State Unit on Aging, and when applicable, also by the Long-Term Care Ombudsman. Now, this reference to the signature of the Ombudsman is important. Any issue to be addressed that in any way touches upon or is relevant to the Ombudsman program will also require the Ombudsman's signature on the cover letter. State units on aging should be careful to consult with the Ombudsman regarding these potential issues. Now, the cover letter needs to include the following information. Again, all of this is in the instructions, so you don't have to worry about taking notes, but this information is going to have to be in the cover letter. The State Unit on Aging has to confirm in writing in that letter that they will use good faith efforts to fully comply with the applicable requirements, that they will collaborate with ACL in finalization of the corrective action plan, for example, identifying the progress milestones and a feasible timeline to come into compliance. And the SUA also must confirm in writing that it will provide written updates to ACL as to the status of the action steps to be taken under the plan as agreed to by the parties and as otherwise requested by ACL. The letter also needs to include the projected date by which the SUA will fully comply with the applicable requirements. The proposed corrective action plan, together with the cover letter, must be submitted to your regional administrator no later than October 1st of 2025 for ACL's review. ACL's written approval of the corrective action plan will be required. And again, we anticipate that finalization of the corrective action plan will be a collaborative process. The State Unit on Aging and ACL will jointly identify progress milestones and a feasible timeline for the SUA to come into compliance with the applicable requirements. Now, October 25th is a long way off. So here's what we are thinking. It's possible that you definitely know now that you will need a corrective action plan. Say, for example, a state law needs to be amended and your legislature will not meet again until January 2026. In such a case, you could submit a proposed corrective action plan now to address that situation. Please talk about it first with your regional administrator. There is plenty of time for you to submit a proposed corrective action plan to ACL. Again, you have until October 1st of 2025 to submit your proposed plan. We recommend that you take the next several months to plan out what will need to be done and figure out your timeline. The spring of 2025 would be a good time to meet with your regional administrator, talk about where you are in terms of coming into compliance and where you see challenges or need assistance. By the summer, we recommend that you have another conversation about this with your regional administrator and start to think about putting a proposed corrective action plan together so that you can submit it no later than the October 1st deadline for ACL's review. Of course, you don't need to wait until October 1st of 2025 to submit your proposed CAP. Once you are confident that you will need one, we recommend that you go ahead and submit your proposed corrective action plan to ACL. For all corrective action plans, we recommend that you first consult with your regional administrator for assistance. Next slide. All right, now on to the template that will be used for corrective action plans. Here it is on this slide, and here is how to fill it out. It's very simple. So column A is where you insert the specific sections of the OAA final rule with respect to which the State Unit on Aging is out of compliance. In column B, you're going to explain three things in column B. First, how the State Unit on Aging is out of compliance with the specific requirement that they referred to in column A. The amount of time the State Unit on Aging will need to comply with this applicable requirement, and also why the State Unit on Aging needs this amount of time. So those are the three things that are addressed in column B. In column C, you're setting forth the action steps to be taken by the State Unit on Aging to remedy the noncompliance issue. For each action step, also include the date by which that action step is projected to be completed. Now, we're looking for major milestones here. We do not want to get into the weeds with you. I'll be showing you a couple of examples to give you an idea of what we are looking for. In column D, you will insert the projected date by which the State Unit on Aging expects to be in compliance with the section that is reported to be out of compliance with in column A. And then column E will be used for updates as to the status of the State Unit on Aging's efforts to resolve the noncompliance issue, such as the status of the action steps to be taken by the SUA to resolve the noncompliance issue, and when the SUA believes it has fully resolved the issue. This is where you will provide updates to ACL as to the status of the action steps as agreed to by the parties and as otherwise requested by ACL. This is important. ACL and the SUA should agree upfront on an update schedule. Now, note you're going to address one issue per row. So where you're inserting your different milestone steps for C, and you're inserting those three things you have to disclose in column B. For that one specific issue that you put in row 1, everything is going in row 1 for that one issue, using one row per issue. So, and what we're contemplating is you will add additional rows and pages as needed if you have a number of issues that you need to address. We are contemplating that we will enter into one corrective action plan per SUA. So again, additional items that arise after the initial establishment of a corrective action plan can be added to this corrective action plan. Please contact your regional administrator with any questions. Next slide. All right, now I'm going to go through a couple of examples with you. In this example, the State Unit on Aging is noting the requirement in 45 CFR 1321.29C that it have a minimum public comment period for state plans and state plan amendments of 30 calendar days. The SUA is noting that it is not able to comply with this requirement because there's a state statute that limits such a time period to a maximum of 15 calendar days. So again, they're telling you the first thing they have to disclose, which is what is the problem? How are they out of compliance with the provision? The next thing they have to disclose is by when they think they're going to be in compliance. So again, how much time they need to come into compliance. So they're requesting until July 1st of 2026 to amend the statute in order to comply with this 30-day minimum calendar period. And then the third thing they have to disclose is why do they need until July 1st of 2026 to comply with this requirement? And the reason they need that is that the state legislature is going to need to amend this statute in order to change the minimum calendar days. And the legislature meets every 2 years and will not meet again until January of 2026. So again, here in B, they're explaining the 3 things they have to disclose: how they're out of compliance, the amount of time they need to come into compliance, and why they need that much time. I'm not showing you column A because that's kind of simple. And all you would put in column A is that CFR reference there at the top in the first sentence, 45 CFR 1321.29C, that's going to be inserted in column A. You can go on to the next slide. Okay, so here we're looking at column C, which are going to talk about the action steps that the State Unit on Aging is going to take to come into compliance. So here for this example, this State Unit on Aging needs to draft an amendment to the statute that will allow it to do this 30-day public comment period. And they are going to have to obtain the necessary approvals that they need in order to submit this amendment to the legislature for signature. And the State Unit on Aging is projecting that it's going to need until November 30th of 2025 to get these steps done. Then the next major milestone is in B. You'll see they're going to submit the amendment to the legislation for consideration during the 2026 legislative session. And the State Unit on Aging is projecting they will have this completed by January 2nd of 2026. And then the last step is that the amendment is approved by the legislature and in effect, and they expect that to be completed by July 1st of 2026. So again, let me just reiterate. We're looking for major milestone steps here. We do not want to get into the weeds with you. So there will be many internal steps that you will be taking to get to achieve each of these milestones. You may have meetings. You may need time to do research. You may be reviewing materials and other steps that you have to take. You will be setting your own intermediate milestones and will have your own internal plan for how you're going to come into compliance that are going to get into much more detail than what needs to be disclosed to us here in this corrective action plan template. Now, again, I'm not showing columns D and E in this example, as well as I'm not showing A. The projected date by which the SUA would be in compliance would be inserted in column D. So here in this case, the date that would be inserted is July 1st of 2026. Again, column E will be used for updates as to the status of the SUA's efforts to resolve the noncompliance issue. Again, such as the status of the action steps to be taken by the State Unit on Aging and when it believes it has fully resolved the issue. Again, the State Unit on Aging and ACL should agree upfront on a schedule for the SUA to provide status updates. Let's go on to example 2. Okay, let me go through this example. So here we are noting that 45 CFR 1324.303 D2 lower Roman numeral 1 prohibits the State Unit on Aging from designating a legal assistance developer who holds a position or performs duties that could lead to decisions that are or have the potential of being contrary to the legal assistance developer's duties. Specifically, 45 CFR 1324.303 D3I, so this is another section within 1324.303. This additional section prohibits the State Unit on Aging from appointing a legal assistance developer who is also serving as a director of adult protective services or as legal counsel of adult protective services. The State Unit on Aging currently employs one individual to serve as the legal assistance developer. They're spending half of an FTE's time doing that work. And that person also serves as counsel for the Adult Protective Services program. They're spending the other half of their FTE time working on that other program. So again, here is their explanation for the first thing they have to say, which is how they are out of compliance. And in column A for this one, those two CFR sections that are referenced in A within this slide would be listed in column A. That's all you have to do is just list those two sections in column A. The next thing that the State Unit on Aging has to disclose here is how much time they need to fix whatever the issue is. And here the State Unit on Aging is requesting until April 30, 2026 to reorganize their staffing assignments so that they can eliminate the issues that they noted above. And lastly, the State Unit on Aging has to explain why they need this much time to be able to come into compliance. And here the state is explaining that they decided to reorganize their current staffing assignments in order to comply with these two sections. They're explaining that the change requires a comprehensive review of their state and federal laws and regulations addressing this position. And they also need to look at their requirements for administration of programs within their own offices, approvals of changes to agency staffing organization are going to be needed, and also training of staff in new assignments also are expected to be needed. So they're saying that's why they need this much time. Next slide. Here, this is again their column C, the milestone steps that they'll be taking. So here in this example, they're going to review these two sections of the CFR as well as other applicable state and federal requirements related to the position requirements for the Director of Adult Protective Services and the legal assistance developer. And they will draft proposed job descriptions for the legal assistance developer and for the Director of Adult Protective Services to ensure that mandated programmatic responsibilities are adequately addressed. And they anticipate that they will complete this work by December 1st of 2025. Their next major milestone here is that they're going to draft a new organizational chart integrating the modified positions which comply with these two CFR sections, as well as comply with other relevant state and federal requirements. They also will need to be evaluating their current staff and budget to determine new staffing assignments, and they're going to possibly need to obtain internal departmental approvals of these revised positions. And they are anticipating that they will get this work done by March 1st of 2026. And then finally, they're anticipating that they will complete all necessary steps, including, for example, training, to have the new staffing assignments effective by April 30 of 2026. Now, again, we are looking for major milestone steps here. We do not want to get into the weeds with you. And again, you likely are going to be undertaking many internal steps that will be parts of each of these major milestones that you're sharing with us. You likely are going to develop your own action plan. You're going to have your own tool that you're going to use to track all of the work that you are doing. As you develop these tools, if you're willing to share them, we would be happy to receive them and make them available to your fellow state units on aging. Now, again, I'm not showing columns D and E again in this example. Now, the projected date by which the State Unit on Aging will be in compliance is what gets inserted in column D. So here, April 30, 2026 will be inserted in column D. And again, column E will be used for updates as to the status of the SUA's efforts to resolve the noncompliance issue. Again, such as the status of the action steps to be taken and when the SUA believes it has fully resolved the issue. The State Unit on Aging and ACL should agree upfront on a schedule for the SUA to provide status updates. Next slide. That concludes what I was going to talk about for the corrective action plan process. And we're now going to move into concluding remarks and a discussion of resources. Next slide. So coming soon, ACL will share when available the final and approved state plan guidance, as well as the corrective action plan template and instructions. The instruments, as well as slides and the recording of this webinar, will be posted to the OAA Final Rule webpage, as well as the current AOA Program Instructions webpage within ACL's website. The OAA Final Rule webpage, and that's https://acl.gov/OAA rule, also currently includes the Back to Basic webinar series information and materials, including the recording and slides of the Back to Basics webinar on state plans on aging, area plans on aging, and IFFs that was held back on June 27th. Please also save the date of November 7th at 2:00 p.m. Eastern for the next Back to Basics webinar on contracts and commercial relationships. Webinar registration will be made available on the OAA Final Rule webpage after this webinar, and an ACL update will be forthcoming. Let me mention something about fact sheets. We have 2 general fact sheets, a short 2-pager and a longer expanded 6-page fact sheet to give an overview of the final rule. There are also fact sheets on key topic areas such as fiscal policies and procedures and nutrition services, with more to come on additional topics. The site includes additional resources as they are made available. For example, under More Resources for Grantees, the Title III Select Topic Areas to Review for State Units on Aging document serves as a tool and highlights certain noteworthy provisions of the Older Americans Act Final Rule for SUAs and AAAs in communication with their respective SUAs to review as they begin implementation of the OAA Final Rule. The topic areas have been selected based on whether the OAA Final Rule established a new requirement, clarified an existing requirement, or modified an existing requirement. This may assist as you work to update state plans or submit state plan amendments to come into compliance with the OAA Final Rule by 10/1/25. Next slide. For your reference, this slide provides a list of the acronyms and abbreviations commonly used for this webinar today. Next slide. I want to thank you for your interest in this webinar on the new State Plan on Aging guidance and corrective action plan process. We know we covered a lot of information today, and we hope that the State Plan on Aging guidance, the corrective action template, and the corrective action plan instructions will help make the requirements clear regarding planning and development of the state's aging network while coming into compliance with the OAA Final Rule. We thank you for all you do for older adults and caregivers across the U.S. This concludes today's webinar.